Hey YouTube, it's Marita from the Nurse Lounge, and today we are doing a video on subscriber request, or actually I think it's a subscriber request, or if not, she's on IG and she requested it from there. Either way, we're doing a video on nurse interview tips. So she asked, could I do a video on nurse interview tips and nurse interview tips specifically for OB? I have already done a video on nurse interview tips that I will link to this video. So this video is specifically for nurse interview tips for OB. If you want to see what I suggest you should be prepared for if you're wanting to interview for OB position, stay tuned.
Where my girls at? Independent, free spirit. Ooh, it's some serious. Where my girls at? We linked up in a cool minute.
Okay, so we're gonna jump right in. I have some notes per usual that I usually take, so you'll see me look down from time to time. And we're gonna just dive right on in. So we are again talking about interview tips for OB. And I've broken them down into 3 categories. Things to consider before you interview for a position in OB, things for during the interview themselves, and questions to ask your interviewer, okay? So that's what these are. Interview tips for OB specifically. Things you should think about before you actually consider yourself going to OB if you want to be an OB nurse, mother, baby, L&D. Just so you know, OB encompasses mom, like labor and delivery, some places an antepartum unit, high-risk OB, mother, baby, couplet care, and nursery if they have a well baby nursery. And then NICU is its own component. So that's kind of what we are talking about. If you want to, most times when people say OB, they're talking about either labor and delivery or couplet care or nursery. But some hospitals have specific units, like they have, let me think, like this one hospital that I have been to, they have an antepartum unit, like a high risk antepartum unit where they're still pregnant, or they have a high risk OB unit. So they're so specialized there, they have separate units for certain things. On my postpartum unit specifically, we do antepartum, high-risk OB, postpartum, and GYN all on the same floor. So again, you got to know what you're really dealing with. So anyway, before the interview though, before you consider, do I really want to be an OB nurse? These are the things that you may want to consider. So the first thing I put on here is consider where you are yourself in terms of having children. And I say that because if you are still in the process of having children, there's nothing wrong with wanting to plan to have a family. But sometimes if you're planning to get pregnant this year, OB is an area in which we lose a lot of nurses due to pregnancy. A lot of our nurses, it's just either in the water, it's just something we do. But a lot of us, so the nurses, the managers are having to plan around maternity leave and things like that. So be mindful of those things that, if you're planning to have a family, where are you in that process? Because a lot of the times people don't come back after they have their baby. Sometimes they do. Sometimes they'll go from, say, full-time to part-time if that's available. Or sometimes they'll go from part-time to PRN if that's available. Or sometimes they just quit because they want to actually raise their family, especially if it's their first baby. So be mindful of that. Where are you in regards to having your baby? When I went into OB, I already had 2 children. And then I had 2 more since I've been a nurse, working in OB, obviously. So they had to factor in me going on maternity leave. Myself, I have high-risk pregnancies as is. So I had to have abbreviated shifts or half shifts where I only worked by doctor order, only worked 6-hour shifts instead of 12. So then they had to find someone to work the other 6 hours for me, to fill in for the whole shift or whatever. So be mindful. Where are you in that process? If you're done with all of that, having babies, then that's one thing. But if you plan on getting pregnant this year, that's something totally different. I would probably focus on one thing or another. Now, mind you, if you need a job, you need to work, you're just getting out of school, you do what you have to do. Just do what you have to do. But again, that's something that they kind of want to know, where are you they may not say that directly to you, where are you in that process of having children, or how do you feel about this and the other. But I do know there was a nurse, as an example, who she was a student of mine, and she wanted to get a job in OB. She wanted to get a job in the nursery. That's what it was. And she came to me and said, hey, I want a job in the nursery. She said, I found the manager or whatever, and I talked to her, but I told her specifically, I'm not moving, because we live in a military town, or I don't, but the hospital is in a military town, so you have a lot of deployment, a lot of wives that will move because of the fact that their husbands are deployed, so they go back home to their family or whatever. So we have a lot of people who leave because of military things, or because of the fact that they get pregnant. So she used that in her bargaining tool to say, hey, I'm done having children already, and I'm not going to be moving. So that way she would know she would have an employee that's there for the longevity, not for just 6 months to a year or whatever. So you have to use those things to your advantage. So therefore, think about that. The next thing I put on here, are you okay with working nights and being floated? 9 times out of 10, and sidebar, this video is specifically for new nurses, new graduates, new nurses. However, the same things do apply if you're already a nurse wanting to come into OB. It's just that you have another bargaining tool because you already have experience already. And so for a lot of people who are coming into OB with no experience as a new grad, you're going to have to use which, you're not going to have anything really. So, I'm really speaking to those who are new grads in this video. However, again, a lot of these things do apply to someone who is coming from another area of nursing into OB. So are you okay with working nights and being floated? Think about that. 9 times out of 10, you're going to go straight to night shift first. You're going to orient during the day, and then you're going to orient at night, and you're going to stay on nights that's where you're going to be. And then on top of that, just because that's usually where the openings are, is at nights. And then after that, are you okay with being floated? All hospitals don't have a policy on being what's called a closed unit. Our unit is a closed unit. That basically means that as a closed unit, we staff our own unit. We don't staff the hospital. So anytime the hospital has a situation where they're needing more nurses, we don't get floated to other units. The only exception to that is like in emergency situations, or like this past January last year, I got floated to Med-Surg because we had a flu epidemic for the hospital, and we also had a winter storm in that area. So therefore, not only people who were sick with the flu, nurses were sick with the flu, we also had people who could not get to work due to the winter storm. So even though my unit's a closed unit, we stay on our unit. In that situation, we all came in, but we had to come in to service the hospital, or to actually serve the hospital and work on Med-Surg or ER or wherever we got floated to. I was floated to Med-Surg, and I got floated for half a day, and then the other half a day I was floated to ortho. So, and I floated as a tech, but my point is just that you be mindful. Are you okay with being floated? The next thing is to ask around to see if there's a good fit with nurses. So basically, talk to the nurses on the floor. Find out if if you're already in OB already, if you're already a nurse already, and you work, say, on Med-Surg, come down and meet some of the nurses on the floor. Maybe run into them in the elevator, or run into them in the cafeteria. Talk to the nurses and kind of see what the feel is like. What kind of is it cliquish, which it usually is, but what is the energy like on that floor? Is it something that you be into coming down and just kind of, being with that? You just never know. You never know if you would fit in, type of thing, or just kind of find out what it is from there. Be mindful that a lot of times these hospitals do what's called peer-to-peer interview. So therefore, it may be, if you're wanting a job on our unit, maybe I would be the person, it'd be several of the nurses who already work come and interview you for your position. It may, in addition to the nurse manager who will interview you. So be mindful that, are you okay with that? Are you okay with your peers, someone who you'll be eventually working with, interviewing you? That's a big thing that they do nowadays, is peer-to-peer. So be prepared for that. Meet the manager if possible face-to-face. So this is what I was saying earlier about the nursing student that I had, who she actually went to the nurse manager herself. She ran into her, or maybe a nurse told her who she was. And she was actually my nursing student, so she did clinicals with me. And while she was there with me doing clinicals, she had somehow found the nurse manager and say, hey, my name is, I'm from, this university. And she told them that I was her preceptor, or not preceptor, no, clinical instructor. And that she had an interest in doing whatever position they had open. And she didn't care where she worked. That's another thing. If you don't care where you work, they want to put you in nursery first or whatever. That's what she did, and she got the job. She ended up getting the job. But then the more she went to go talk to this nurse manager, the nurse manager was able to put a name with a face, realized that she was a student of mine, and I allowed the student to use me as a reference because she was a very good student and she actually did what she needed to do. And if she did not, then I wouldn't let her use me as a reference. But my point is this, you know, she met that manager face to face because she was hungry. She went for it. She actually went and talked to that manager and said, hey, I really want to work here. This is my situation. And this is another thing. If you are already in school right now as a student and you're doing your clinical rotations, but you happen to, when most schools do what they call a preceptorship, where you do so many hours with a certain, you know, nurse in that certain skill set or that certain specialty. If your school allows you to, and you know OB's where you want to go, it is best for you, especially if the hospital's in your town or where you're at, to see about getting your preceptorship with on that unit that you want to be on. So OB in this case. So I always recommend getting to know the nurses. That way you can say, hey, you know what? This is something I really want to do. Would you mind being my preceptor for my preceptorship for nursing school in OB? So utilize your clinical time. And this applies to you even if you don't want to do OB. Utilize that clinical time to get to know the nurses. Find you a good nurse. When it's time to do the preceptorship, you can link up with him or her. So that way you can kind of get a feel. If that's a facility that you want to work at, that's where you know you want to work, then this is like a win-win for you. It gets you a foot in the door, number one. You get to work along the nurse, and the nurse says to see, is this a good fit for you? Would you want to work with these other nurses? And you get to see a taste of how the job would be if you actually want to try it before you buy it. So definitely, if you're in school, go and work with, you know, see about getting a preceptor on that floor. Excuse me. Get a preceptor on that floor so that you can better time manage and better acclimate yourself to see if this is what you really want to do. I tell students that all the time. If you know where you want to be, you need to be using your clinical time there. So if you want to be ER as an example, and when it's time for you to do your ER clinical days, get to know those ER nurses, find that ER manager, find these people, ICU, find that person that you want to meet these people so that you can say, they can put a face with a name. Hey, my name is, and I'm really interested in working ER or ICU or OB when I finish school. So I wanted you to put a name with a face. I'm going to be checking the website to see if they have any openings, and I will be applying for that position if you're hiring new grads. You know, definitely put yourself out there. Keep in mind, nurses come a dime a dozen. You are not a rarity. So if you're not a rarity, you have to do something to stand out to get these jobs. Because everybody, med-surg is going to be plenty of positions for med-surg, but majority of us don't like to go to med-surg. So if we don't want to go to med-surg, we want to go into a specialty area. What makes you stand out from everybody else? Because, you know, again, nursing students come out a dime a dozen. So you have to stand out. Don't be afraid to go and meet the people, meet the manager, find yourself a preceptor. You have to be a go-getter. If you're not a go-getter, then you're going to get left behind. That's basically how that works. All right, so that's all I have for before. Think about those things. Now, during, so you have the interview. You have the interview now. These are the things that I suggest that you consider, think about, or have a response to if they ask you. So the first thing is always dress to impress. This is not what they're going to ask you to do. If they tell you come in scrubs, if they say come in scrubs because we want you to shadow on the floor, then do as you're told to do. So dress to impress. I always say that. Again, I will say that if you were told by the manager to come in scrubs because they want you to shadow a nurse for a few hours, then do as you're told to do. Me personally, I would even ask the question, is it okay if I come dressed for the interview and bring scrubs with me to change into? Because I want them to know that I set a standard for what I present myself as when it comes to being the appropriate employee that you want to hire for this job. However, if they say, no, just come in scrubs, it's okay, then you do exactly as you're told. If they do not tell you to come in scrubs specifically, you need to come dressed to impress. That means you need to be wearing black, gray, or blue in terms of suits. In terms of as a female, you need to have, I would say per se a suit, but you know, a very nice bottom and a very nice top. A white shirt and either a gray, black, or navy blue bottom would be appropriate. with a nice jacket or a cardigan or something to go over it, but you always, 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 always want to come dressed to impress. You want your makeup to be modest. What I have on right now is not modest. So my eye makeup is fine, but my bold lip probably needs to be more of a nude type color. Believe me, that does matter. So a nude lip, the makeup itself is okay otherwise, but basically a whole nude lip. The only thing I usually wear is more of a bronzer and a slight highlight. I'm more highlighted today than normal, so probably not as much highlight as I have on right now, but a nude lip or a brown lip would be very appropriate for an interview. I always tell women when it comes to earrings, I have three piercings right here. I wouldn't necessarily wear all 3 piercings, or if you're gonna wear a hairstyle where it's gonna cover, that's fine. But you want to make sure you have on either like just a stud, a diamond, a small hoop, or pearls always are classy. I always tell women to wear a pearl necklace if she has one. And they're cheap at Walmart. They ain't going to be real pearls. Get you a necklace at Walmart. Pearl necklace, if you have it, pearl earrings to match, or if nothing else, a stud or something like that. I'm not saying you go spend a whole lot of money, but when it comes to certain things, you should always, as a woman or even a man, you should always have a suit or a black and white or something like that. I always tell people, have you an all black something, because it's good for a funeral and it's good for an interview. So if you have you a black suit or a black dress or a black whatever, then you are ready for your funeral and you're ready for your interview. So you have those things, you're good to go. So again, you want to have that look to say that I'm conservative, I'm very well polished, I'm well groomed. If you happen to be a man who wants to go into any area of nursing, but then you want to make sure that you're freshly shaved, that you have a fresh haircut, that you're lined, things like that. If you do have earrings, that I probably wouldn't wear them. Ladies, do not go in with the little piercing that's right here in the eyebrow or on the lips and things like that. I'm not sure how people feel about the little post on the nose. I personally would probably say not to do those, to go ahead and put a spacer there so that you don't have it, because you can't wear it to work. So things that you can't wear to work, don't do it at an interview. Don't have these piercings where you can't have them if you could not have that at your actual job. That's another big tip that you should know. Be dressed appropriately. Again, we talked about the nude lip, the pearl earrings. Hospitals have moved in terms of how they feel about tattoos. Our facility now is allowing us to have tattoos that visibly show, as long as they're not offensive. I would say to be safe, to go ahead and keep your tattoos covered for the interview, because they become a distraction and you want the job. So I'm not saying if it's summer, no matter what, you would need to wear sleeves, so just be mindful of those types of things. As a female, you don't want to come in there with all these acrylics on, knowing that you're about to get a job where you can't be wearing acrylics anyway. Come ready to work. In terms of have the look that you would normally have. I wouldn't say have the look you normally have, because I'm one who, if I'm going to go on an interview, I'm going to be put together. But I'm just saying, I would not be wearing acrylics knowing good and well that you can't wear acrylics on the floor. Or you shouldn't be wearing acrylics on the floor. So that's all I'm saying. Just be modest with that. No, they're only having some nail polish on or whatever because you're trying to get a job. But just make sure that you're modest with it, so that they can know that yes, you are serious about this position, and that you are ready to go to work. If they needed you to work tomorrow, you'd be ready to go to work, because they don't have to tell you to take your piercings out. They don't have to tell you to, your makeup's a little too much. Things like that. All right. The next thing I want you to know is, or the question I typically ask you, what makes you want to work in OB? Be ready to have an answer for a question, something worded kind of like that. Be thinking about that. Why would you want to work in OB? And I can't come up with an answer for you. This is going to be your answer. But be thinking about what makes you want to work here? What's so special? Why don't you want to go work med-surg? They may ask you a question that's kind of around that. So be ready for that. The next thing I put on here, this is an interview question that I've heard in retail, in nursing or healthcare, in virtually every aspect of trying to get a job. Name a time in which you had a conflict and how you resolved it. Like, name what the conflict is and how you resolve that conflict. They want to know how you interact with people, how well you deal with people when there is a problem. As you know, with people in general, there's going to be a problem at some point. So you want to make sure that when you have issues, that they know that you know how to appropriately handle that without trying to roughhouse? Do you even know the chain of command? That's something to know. First, I would try to resolve the issue with that person. Then after that, I would go to the next step and go forward like that. But you need to be able to answer a question like that. How, what did I just say? Name a time in which you had conflict and how it was resolved. Okay, so that's another thing to think about during the interview. How would you answer that? I have on here, if you do have children, use that to your advantage. So you can empathize. You can simply say something along the lines, I know what it's like to be a new mom. I, had a baby, and again, be brief in this. Don't tell the whole story, but be brief in terms of saying how you feel. The story I used was, I know what it's like to have a baby in the NICU. I had my second daughter who did go to the NICU, and it was actually at that moment right then and there I decided I wanted to be a nurse. And because I wanted to be able to care for moms who have situations similar to mine. And that's something I use, and I use that, quite often or whatever. Or I'll simply say, hey, I know what it's like to face adversity, to have children at a young age and have to deal with the welfare system and all that. I just want to be able to give back and show the people that I can be that where you could be, where you can come from. I want to inspire and encourage. Not that will come out in a conversation with your patients per se, but sometimes it does. I've had plenty of conversations where people are like, you don't look old enough to be a nurse, or they'll, in conversation, with moms, with a new mom, a patient, they'll ask me, do you have any children? And I'm like, oh, yes, I have 4. And I'll go through their ages. When I say 21, like 21, you don't look old enough to have a 21-year-old. You look like you're only 20 something yourself. I'm like, yes, I have a 21-year-old, and she's this, the other. I have an 18-year-old, I have a 10-year-old, I have a 7-year-old. I have all these kids, all these kids, and I'm still here, as a nurse. So, with that being said, I'm always using these things to my advantage. I use negative things to my advantage. Things that was not good for me. I use those as stories to say, I want to be a testament to what it could be if I work hard and show that I worked hard despite having these kids and falling behind in life and things like that. So I've used those kind of stories in my interviews, and they're like, oh, okay, they're kind of impressed by that. The next thing I have on here is if you happen to be a minority, wherever you're going to be at, use that race card. Use it. Let me tell you why I say use it. And this, if you happen to be Caucasian, but you're going to work in a place that's mostly minority, you can use the same technique. So this has nothing to do with, if everybody is there who's a minority and you're happen to be one of 2 or 3 white person or Caucasian, or whatever it happens to be, use the same thing. What I always say is, and I use this everywhere I go, is I believe that we need to have a more diverse workforce. So therefore, based on some of the people that I've seen, as I've done my tours or things like that, I see that, for the most part, that your workforce or your employees or your staff is basically a certain, I won't say a certain race, I wouldn't quite say it that way, but basically by me coming here being an African American woman, I would help with the diversity. And I feel that patients should see a diverse workforce. They should see diverse staffing. And I always say that, truly being known, I say African American patients relate well to African American nurses. And that's not a lie. That's facts. That's actually statistics. You can go look it up, research it yourself. People relate to who they relate to. So therefore, I had a nursing student who she was Vietnamese. And we had a patient who happened to be Vietnamese. I actually put them together because she was able to help us understand, the rest of us understand the culture as to why she wasn't doing as the patient wasn't doing certain things, because she explained the culture to us that we didn't even know. So use that to your advantage. Not in the sense of like, okay, I'm going to use a race card for affirmative action, but that you want to make sure that the workforce or who you're working with or your staffing is reflective of the population that you're serving. So if you happen to be Caucasian and it's mostly a minority staffing, you bring diversity too. So you come in there and say, you know what, I noticed that your staffing is mostly ethnic minorities. By me having me here, I feel like we can diversify the your staffing. And I think that I would add to that by being a valuable member by helping diversify the staffing. So I always use that to my advantage, and I usually do that based off of research. Mind you, I've already looked at the staffing. I've already looked at nurses. Like, okay, how many? I don't count per se, but just by eyeballing it, how many people look like me, how many people don't look like me. You know, if you happen to be a male who works at, well, never mind, that's not a good example because in nursing it's mostly female dominated anyway. But maybe it's an ICU unit for some reason, or ER unit that has mostly males in it, and you're a female, and you're kind of like, you know what? I want to bring some estrogen in here. I want to bring some diversity in here. I want women to work in ICU. I mean, maybe you live in an area that is something like that. Don't be afraid to use those types of things when you're doing your interview. All right, so now we're going to go on to, so we first talked about things to consider before you interview. Then we talked about during your interview, questions that may be asked of you that you need to think about, or things that you should even, bring up. Questions to ask. So at the end of an interview, they usually will say, do you have any questions for us, that you would like to know from us? And don't ever walk away saying, I don't have any questions. Because for one, you should have taken some time to research the institution that you're going to work for. What is the vision or mission statement? Maybe that should go in before too. That you should have looked up the vision or mission statement for that facility or wherever you're going to work at, because you want to know what they stand for. If you are, here's an example. We have a hospital that is a Catholic hospital. So therefore, if you truly have a thing about people getting, like, they can't do tubal ligations at a Catholic hospital because they don't believe in birth control. So, and tubal ligation is a form of birth control, so you can't get that procedure done there. If you don't feel that that's right, you have no business working there. If that bothers you to that extent that you don't feel like that's right, you have no business working at that Catholic hospital, because, I'm giving you an example on an OB, that a tubal ligation is something where we do, in case you don't know, to cause mom to be permanently sterile, even though it's not 100%. But they either burn, clip, whatever they're going to do to those tubes so that she can't get pregnant again. Again, it's not 100% effective, and that's not what this video is about. But my point is, because we are preventing her from getting pregnant, Catholic religion does not allow that. So therefore, that can't be done in a Catholic hospital. Don't get you a job there if that's not something that you're okay with. So that's just an example. So questions to ask the interview people. So the nurse manager usually is who you're going to ask these questions to. First question is, what is your nurse-patient ratio? You need to know that up front. If they come telling you that it's a 1 to, let's say if you're doing couplet care, it's usually 1 to 3. And I was told this in my one job, that it's 1 to 3, but on occasion we do 1 to 4 because sometimes we have high census. Well, I was okay with, and I did get the job and I did work it for about 1.5 years. I was okay with the 1 to 3 and I was okay with the 1 to 4 on occasion, but we had the 1 to 4 more often than we had the 1 to 3. That I wasn't going for. By asking these questions, you're having them think, ooh, they're asking these questions. Maybe we need, they know that you're thinking. They know that you talk to someone. They know that you're kind of like, okay, this is a high value and potential employer that we're going to have, because they're asking appropriate questions. They're going to follow the rules and policies and things like that, or at least they hope you are. So what's the nurse-patient ratio? Nurse-patient ratio. On average for postpartum, it's 1 to 6 on average. On L&D, it's 1 to 6 if nobody's in labor. It's typically 1 to 2. If you're laboring, you have, I think, 2 patients. I think somebody's an L&D nurse needs to come on here and tell me if that's right or not. But I think it's 1 to 2 if you're laboring, if they have 2 laboring patients. But obviously, when it's time for delivery, that's a one-on-one type of thing. But I think it's 1 to 6. At least at our facility, it's 1 to 6 if you have no laboring patients. You can have up to 6 patients in labor and delivery if there's no laboring patients. So you have maybe some observations or things like that you're doing. For a magnesium sulfate patient, that's a 1 to 1 ratio. Certain situations recall certain things, but for the most part, it's 1 to 6. Nursery is around the same thing, 1 to 6. If it's just a regular nursery, not a couplet situation. NICU is totally different. So I don't know NICU's ratio, so I don't know that. But you need to ask those questions. What's the turnover rate? You need to know what the turnover rate is, because you want to know, are we losing losing nurses as fast as we get them, and then why? Why? Sidebar on the turnover rate, if there is a sign-on bonus, I guarantee you it means because they can't keep anybody. The higher the sign-on bonus, the worse it is at that facility. Be mindful of that. If they're offering $10,000 sign-on bonus, that means there's a problem at that facility. Know that. And if you take it, the sign-on bonus, be ready to pay it back, because there's going to be a good chance you're not going to be able to survive either. So either not pocket money, put that money to the side, or come up with a way to save the money or whatever, so that you can be ready to pay that money back if need be. It is not easy to deal with the sign-on bonus. I did a sign-on bonus before. It's for $4,000, and I'm telling you, there's a reason why. There's a reason why, okay? And they're doing it differently now. A lot of the facilities now are giving you your sign-on bonus like incrementally. They don't give it to you up front in the first place, in case you don't stay. So, sidebar, high turnover rate, you see sign-on bonus, like, oh, they're offering $10,000. Okay, yeah, there's a problem there. Why they're offering $10,000. Another question to ask is, what is your patient population? So, again, like I told you, ours is antepartum, postpartum, GYN surgeries, and high-risk OB, meaning we have the drug moms, what is it called? Comorbidity. So she has diabetes. We have all the issues like that on one floor. Whereas some other facilities will have that broke down into different floors, because that facility is very large, type of thing. It's like a women's hospital, a whole women's hospital would have that on different units, where ours, we just have one floor of a hospital, so all that's on one side for us. So what kind of population do you have? Do you see a lot of drug issues here? Do you see a lot of is it rural? Are you in a rural area? We have a lot of Amish and Mennonites, so that's a different culture or population of people that we have here who, they're just very different. Are you in an urban hospital? Are you dealing with those who typically are not insured? Are you dealing with people who are, what type of population do you have? Are you going to do GYN surgeries on your floor? How often does that happen? Things like that. You want to know those kind of questions. And one thing about the nurse-patient ratio, going back to that, or maybe just another question altogether, do you have a minimum number of nurses on the floor at all times? So, for instance, there's one hospital I worked at, my very first job actually, and the ratio was 1-6. But what that meant was, if you had, say, 6 patients or less, there was only 1 nurse on the floor. So 1-6 meant you had 1 nurse if it was 6 patients or less. Period. No, we didn't have anybody else. It was just me. Just me with those 6 patients. At the hospital I work now, which I like better, if we have, no matter how many patients we have minimally, we have 2 nurses. So if we have 2 patients on the floor, 2 nurses, 1 nurse gets each patient. Do you see what I'm saying? There's a difference in that. And I personally, for safety reasons, I happen to like the 2 nurses. We have 2 nurses on the floor no matter what. 2 no matter what on our floor. On our postpartum floor. 2 no matter what. I like that so much better than my very first job when we only had 1-6, so you only had just that 1 nurse for the entire 6 patients. Once you got the 7th patient there, then that's when you got 2 nurses at that facility, because they didn't want to pay for the other nurse to be there if they didn't need to be there, because it's 1-6 anyway. So they factor in our hospital budget that you're going to be 2 nurses at all times, no matter what. You never, for safety reasons, you never know what's going to happen. If something happens to one of your patients and you're in another room, it's just you. How are you going to, if you have to do, somebody's hemorrhaging and you're in another room, how are you going to handle the situation where you're somewhere else? You need minimally 2 nurses on the floor. I personally, now that I've learned and know better, I do not want to work somewhere there's only 1 nurse on the floor. I don't want to work there. It's just not worth losing my license for. I didn't know to ask that question when I was in nursing school. When I interviewed for the job. And I didn't know how important it was to have 2 nurses until I got to a job that had 2 nurses. Then I was like, okay, no. I like this much better because it's safer for me and my patient. So now I will ask that question, how many nurses do you have minimally staffed every shift? Minimally staffed. That's another question. I already said, are other patients on the floor? So, do you have a postpartum patient, but you also have GYN patients on the floor? That's what I mean by that. How do they feel about continuing education? So, I've been places that have problems with the nurses going back to school to get their BSN or their master's degree. They just have problems with that. They just kind of act kind of shady or funny towards you after you go back and do that. So ask that question if you plan on going back to school at some point in time. May not mean it today or in the next year, but you want to know if you plan on staying somewhere, that working somewhere, and do they offer tuition reimbursement along those lines? because that may help you make a decision. Maybe you have other fillers out there and you want to make a decision. And you're like, okay, well, this hospital offers tuition reimbursement, so I think I may want to try this hospital to help pay for my schooling. So how do they feel about it? And then in addition to that, do they offer tuition reimbursement or something along those lines? The next thing I put in here is your unit open or closed? And why is that important to know? An open unit means that you will routinely float to other areas outside of your unit. So your unit usually will comprise of L&D, nursery, and postpartum or couplet care, whatever y'all have there. It will usually comprise of that area. So that means for us, if it's a closed unit, that means for us, we staff our own self. That means we have to take call. So our hospital, on our unit, we take call to cover if people have call outs or we have high census days and things like that. We don't reach out to the hospital initially. Now, mind you, once we've exhausted all of our options for our floor, then we will reach out to the hospital to help us in terms of send us a tech or send us a nurse or things like that. But as a routine basis, being a closed unit means we don't go out nor do they come in. We staff ourselves. Now, like at the beginning of the video, I did tell you about emergency situations where, we do have to staff the hospital when there is no other staff. So it's not a complete close. It's completely closed, but there are exceptions to that where I've had to float off the floor. And it's usually, like I said, in the wintertime when we have flu season or when we have nurses who are not able to work for whatever reason or come in for whatever reason, then we have high census or we have low nurse staffing where we have a lot of call outs or whatever. So we have to float to other areas. You want to know up front if you're open or closed unit. Most units will have a rotation log to say, okay, it's your turn to float. So and then you put your name in the log book to say, okay, I floated for this many hours on this date, and that way they'll know whose turn is to float to the unit. So you want to know, is it an open or closed unit? That's important to know. And you may not care one way or the other, which is fine. If you don't care if you float to another unit, you don't care if you float to med surg, you don't care if you float to the ER, you don't care if you float. Sometimes we float to the ER just to be a sitter, for psych patients. So when we float, I only float as a tech. I will not float as a nurse because I don't do med surg for real. I don't do ICU for real. So I make it known that I'm only floating as a tech. So a glorified tech. Now, mind you, if you need somebody to pass the Motrin for you, which techs don't pass meds, 9 times out of 10 they don't pass meds, at least legally they don't. Then if I know how to pass a Motrin, I'm going to help you pass your Motrin. Or if I'm going to pass water and do things like that, I'm going to help you do those things. I don't mind passing certain meds, but a lot of these medications that you will be giving on some of these units, you're not familiar with. And if you're not familiar with them, you're not in a position when they're relying on you as a nurse to be a nurse. You're not in a position to do that and do it safely and to know what you're doing and to know when do you not give this medication, when to know what side effects should I watch for. Could you look them up? Yes, you can. But would you have time on a med surg floor? No, you don't. So me personally, I will only float as a tech. And if they don't like that, they can send me home. And that's exactly what I tell them. Because you know why? Because at the end of the day, I may not have a job, but I will have a license. And at the end of the day, that's all I care about. A job, I can go get another job, but I can't get another license. So I ask those questions at the interview. How, is it an open or closed unit? How often do you have to float off the unit? Things like that. The next thing I have on here, I have 2 things that are don'ts. Don't do these things. Don't ask these questions at the interview. Do not ask about salary because they will tell you when they want to tell you. They will tell you what the position offers when there's time to tell you what the position offers. Again, to work in a specialty area is harder to get into a specialty area than it is to get into med surg. You have to keep in mind in terms of salaries that it differs per location, per city, per whatever, per state, per side of the country, per whatever. In the South, we pay less in the South because it just pays less in the South. They pay more out west towards California because the cost of living costs a whole lot more out there. And I guarantee you, people who say, oh, I make money. Out. Yeah, but if you live out there, you also paying twice as much as what we pay here in the South. So you're really not making no more than we make here, but you're getting paid more to be able to pay your more mortgage that you have out there. If a gallon of milk costs $5 out there, it only costs $2.30 or 40 cents out here, depending on the time of the year. So it just depends, Don't ask about salary because that's considered to be rude in some ways, especially as an entry-level nurse. Entry-level. And that's where you are when you're coming into the hospital. You're considered to be entry-level typically. And if you're coming in as a new graduate, you're definitely entry-level. So those are something, don't ask about salary. They'll tell you when it's time to ask. They'll tell you when it's time to they'll tell you when it's time to talk about salary, about what the salary is. If you are a new nurse, new grad, there's nothing to negotiate when it comes to your salary because you have no experience. So don't come in there saying, well, I want to negotiate my salary. Well, they're like, okay, we offer this many dollars per hour. This is what you get for this level of education, for this, that, and the other. There's nothing to negotiate because what you won't take, somebody else will. So if you really want that job in OB, if you know this is where your calling is, take the job, get the experience, and move on if you feel like the money's not enough. But do not go in there asking for a certain amount of money when you're a new grad and you have no experience anyway. Big, big, big no-no. The last thing I have on here is to plan to request the awful lot. Don't do that. Don't come in here, okay, we are right now towards the holiday season. So let's say you got your job back in, you got it last month in October. Don't be coming in here talking about how you want to take off for the holidays. You should have just started in January after the holidays, because otherwise you're gonna be like, nope, you're gonna fall into this routine where you have to be able to be off. You have to do your holiday. And so you're not gonna be able to come in here as the new nurse and be able to dictate when you're gonna be able to take off. You don't have any seniority. So don't do that. Come in here ready to work. If that means working every single holiday, which hopefully they won't make you do, hopefully, then you come in here working every single holiday. Now, I would ask about that. What is your holiday rotation like? That's another question to ask. What is your holiday rotation like? Do you work, unfortunately, at our job? Now, I'm PRN, so I just pick one holiday and I just work one holiday. So this year I'm working Christmas Eve this year. But I would ask the question. I would simply say, which holidays, how do y'all do holidays here? I've been at places like the one I work at right now for the full and part-time people. They can't get a whole holiday off. So meaning they work Christmas Eve this year and they're off Christmas Day, so they can't travel. They work New Year's Eve and they're off New Year's Day, so they can't travel. Some hospitals will say, okay, or Thanksgiving Eve, or stuff like that, and they can't travel. Or the next year it flips. So they're off Thanksgiving Eve and they work Thanksgiving Day. They're off Christmas Eve and they work Christmas Day. They're off New Year's Eve and they work New Year's Day. So it just flips every single year. So you still can't get a whole holiday off to travel or go anywhere at our facility, or at least on our floor. That's how it works. Some facilities will say, okay, you can have the whole Christmas holiday off, but you're going to have to work either Thanksgiving the whole holiday or New Year's the whole holiday. I kind of like that better because it allows you to travel if you want to travel, but that is not how our facility is set up. So we have to, or at least our floor is set up. So that's how we have to work. Also, they actually add in there hard to fill days. So they're not true holidays, not true holidays, but they're hard to fill days. Days such as Halloween, days such as Easter, days such as Halloween, Valentine's Day. I'm not going to order here, so let's go in order. Valentine's Day is hard to fill. Mother's Day is hard to fill. Halloween is hard to fill. Black Friday is hard to fill. And I can't think of any other holiday, or days, but those are the main days that are very hard to fill that we can't find nurses to work because it's tied to a holiday or tied to something that's not truly a holiday. So ask those appropriate questions like that. I hope this video has been helpful for you to help you kind of guide your way to interview steps for OB specifically. Again, this was a subscriber request, and I thank her so much for asking that question or asking me to do this video because I had never thought about OB specific interview tips. So I truly thank her for that. If you have things that you want me to do a video on, please leave that below because I truly enjoy making these videos for you all because I want you to be to be successful in what you do as a nurse. Whether it be a new grad nurse, whether it be a nurse who is already experienced somewhere but they're coming into OB, or just nursing in general, or maybe you've been a LPN for a while and you want to know how you are about to be an RN now, or whatever you happen to be. So if you find this beneficial, please leave a thumbs up. You see my IG banner. You see my banner. You see the YouTube banner, and I have two IG icons up there. One of them is to my melanin_RN_MPN page, which is the IG version of YouTube, meaning it has pictures over there of my nursing journey, just certain things over there, things to inspire and to encourage you to be a nurse. Memes are over there, funny memes are over there, things about my own personal life is on there, me, my kids, things like that. But it is my version of where there's videos here, there's memes and helpful nursing things there. I have a nursing process post that I just posted over there, so you'll know what the true nursing process is. And I plan on doing a video on the nursing process as well, because most people have forgotten about that. So anyway, Until the next time, you all take care. Bye-bye.